Hi there, everyone. Welcome to today's Facebook Live with myself, Sarah Hunstead, and Dr. Deb. Today we are talking about diarrhea in babies and children, and that it is not always a tummy bug. So just a little introduction before we go any further. My name is Sarah Hunstead. I'm a paediatric nurse, a mum of two. I'm also author of A Life, a Finger, a Pee, Up a Nose, A Practical Guide to Baby and Child First Aid, and I'm founder of CPR Kids. And as usual, I'm ecstatic to have Dr. Deb Levy with us, who is a consultant paediatrician, and I would love you to introduce yourself, if you don't mind, Dr. Deb.
Thank you, Sarah. Hi. As you've already said, my name is Dr. Deb, and I am a holistic paediatrician. I'm also a mum to two young girls who are now 4 and 6. I've worked as a children's doctor within the hospital system as well as in private practice for the past 16 years. And during that time, I really developed a keen interest in how nutrition and lifestyle can truly impact on our children's health.
Absolutely.
So I developed actually a framework for parents, really wanting to guide them with simple, effective, evidence-based tools to help them cut through all that internet overwhelm, all the Google nonsense that's out there, to really implement some helpful, healthy tricks really for their children.
Yep, absolutely. And that's why I'm so excited to have you here, Dr. Deb. Now, full disclosure, I've worked with Deb for a million years. Yes. Not that she look that old that she could possibly have been for that long. You feel like that, don't they? And certainly I just love working with Deb because of that balanced approach that you have and all of that evidence-based practice, which is what, you and I both stand for.
100%.
Exactly. So today we are talking about diarrhea, as I said before, but before we go on any further, if you guys out there, can you give us a thumbs up and a wave while we are live, just to make sure that all the technology is working as it should be? And please, if there's anybody who you think would benefit from this knowledge, please tag them in the comments below as well and share this out, because the more families that have this evidence-based information, the better. So please do so. And what we will do as well, if there's any links or particular references that we talk about while we're here, we will pop them in the comments below as well. So before we go any further, Deb has got some visuals that we will pop up on the screen as well. So I will just bring those up now as we speak. Sorry, I'm a little slow on the technology today, but there we go. Fantastic. So talking about tummy troubles and diarrhea. So over to you, Deb.
Great. Thanks, Sarah. And also just to add on, if anyone wants to ask a question during this, please just post something and we'll do our best to address them. Okay.
Absolutely.
So this is our second in a series of 4 on tummy troubles, and we're talking about diarrhea today. Okay, let's go.
Oh, there we go.
Okay. So essentially this is what we're going to be covering. What is it? What causes it? When as parents you should worry, and what you should be doing about it, both at home as well as maybe with the doctor. So let's go on from there.
Fantastic.
Okay, so I'm guessing that anyone with a child who's had it kind of knows what it is, and it's never pleasant. And you'll be very happy to know that I don't have any pictures of it in this talk. So let's get going here. So there are 2 ways that I look at it, and one is the frequency of the stools as well as the consistency. Overall, it really is just more poo than normal, and it's as simple as that. There are specific criteria that I've mentioned there, but that refers more to chronic functional types of diarrhea. So really what I just want to say is that it's more than normal, and when we go to the consistency, most commonly it's more watery than normal. So we're talking those punamis, I used to call them, and my kids.
I love that word. I love that word, punami. I've been the victim of multiple punamis.
Oh, goodness. And always at the worst times.
Yep. Remind me to tell
in
you
the
a story
hair.
later. Yep, exactly. If we've got time, I'll tell you a story later, but we'll see.
Okay, there you go. So, that is really your classic. But it's also important to note that there are some other types just to keep your eyes out for. And that's what, like the fatty type of diarrhea. So that's either one that looks particularly very slimy, glistens, mucousy, or if they're an older child that maybe doesn't flush so well down the toilet. And then obviously bloody diarrhea, which can either be fresh blood or altered blood, which is very dark, black, and quite smelly. So those are the types of poos to watch for. Let's move on.
And I think one of those things as well is often people would say, well, how do I know? Because poo generally is smelly. Trust us. It smells completely different to normal poo. It is next level. So trust us.
Yeah. And I think, Sarah, sorry to interrupt, but I think you brought up a great point in that, it's actually quite difficult to have a specific diagnosis for diarrhea because every child is different and every child's poop is impacted by their day, by their diet, their levels of activity, their stress, etc. So it really is about knowing what your child's normal pattern is and something that's out of the ordinary. And I know that I'd mentioned in last week's one about a helpful workbook that I've formulated for parents. It's a free download. So we'll link to that as well, just to help parents understand better where their kids are at.
Fantastic. Good. Okay.
Okay. So I try and keep things nice and simple. And I've divided into 3 different types, basically around how long your child's had diarrhea for. So classically speaking, acute is less than a week, but sometimes that's stretched to 2 weeks. Chronic is more than 4 weeks, and persistent or prolonged is anywhere in between.
Right.
And the reason that it's important to differentiate is because how long your child has had diarrhea for will implicate the cause. So they're quite closely related. Typically your acute onset diarrhea that lasts for around about a week is often infective in nature. So your classic gastro, which is often accompanied by other symptoms like vomiting and fever, whereas your chronic diarrhea will often indicate a little bit more serious or underlying medical conditions. So we'll come to that, I think, in the next slide.
Okay, excellent.
So as I already mentioned, the longevity of the diarrhea gives us an idea of the causes. And the way that we look at causes is infective and non-infective. So your infective causes, top of the list, gastro. Yeah.
Yes.
Yes. And usually in children, it's viral. And usually it starts with vomiting and a fever. And as the vomiting starts to improve, the diarrhea kicks in. So that's kind of the classic pattern, but not always like that. Bacterial, you can sometimes have higher fevers, maybe a bit of blood and mucus in the poo as well. Post-infectious is quite an interesting category, and we'll touch on this a few times during the talk. But this is the child who starts with a classic case of gastro, maybe someone else in the household. And P.S., yes, gastro is highly infectious.
Oh,
so
is it wash
your hands and their hands?
Hands.
Yes, exactly, hand washing. But this is the child who has a classic case of gastro, but then has this ongoing loose, sloppy stool, maybe developing a bit of a nappy rash, because again, these poos are normally quite acidic and abrasive, and this can be from quite a few reasons, and I will go into this a little bit later, but that's I see that very, very often in my rooms.
Okay.
The other infective is food poisoning, and again, quite classic, depending on what the food is, anywhere from the ball range of 4 to 8 hours after you've had a bad meal, and usually again it's quite obvious because someone else gets it too.
And often it can be accompanied by that awful tummy pain, and you can certainly see when your children are really uncomfortable with that too. It can be really quite distressing for them.
Yes, thanks, Sarah.
Okay, now what about the non-infective causes? And I'm particularly interested in these as well.
Exactly. So this is a pretty big group, and again, I try and kind of define it down for people and make it a bit more easier to remember. So the first one is like the food we put in our guts, then it's the gut in itself, and then the whole body, and then other elements. Okay. Right. So in terms of the food, that's going to be allergies and intolerances. There's this particular condition called FPIES, where you get an immediate tummy upset from a food, often associated with profuse vomiting as well as diarrhea. And that's a specific allergy. But any kind of allergy can also cause a lot of diarrhea and tummy pains, and that can even progress to anaphylaxis.
It's really interesting. I'll just interrupt you quickly. I was actually diagnosed with anaphylaxis a few weeks ago. So I carry an EpiPen now.
Oh my goodness, I didn't know that.
I know. I'll talk to you about this afterwards too, Deb. But and one of the things I realised I was actually having a loose stool frequently. Couldn't quite figure out why. And of course, the allergy specialist put it all together and he said, well, it's part of your food allergy.
There you go.
Right, there we go. That does make sense. So sometimes, that you shouldn't ignore what's going on either with yourself or with your kids. Don't often think, sometimes you think, oh, it's a bit of diarrhea. But once again, as we were saying, with your particular workbook as well, keeping a record of all of this is so important. So sorry to interrupt it.
No. And then the other aspect is your intolerances. So an intolerance is usually a delayed type of less serious reaction, is where people often see it as. And the most common one that I'll see, and this also hits on the post-infectious type of diarrhea, is lactose intolerance. So often what happens, and the way I describe it to parents, is inside the gut, so the gut's a long tube, there are all these little fingers called villi. And when your child gets, let's say, gastro, the little tips of the villi often just slough off temporarily. That's something that does resolve on its own. And at the tip of those villi, that's where lactase sits. And that's the enzyme responsible for breaking down your milk, the lactose, which is the sugar in milk.
Yes.
Exactly, which is why, your mother or grandmother might say, no dairy when a child's recovering from diarrhea. So that's, and there's actually some truth in that, obviously, depending on the age and the child, etc., and you can't make blanket statements. But certainly that's very, very common that we see, and that is one of the causes of post-infectious diarrhea.
Oh, that's so interesting.
Moving on to the gut. These are, often the more significant illnesses. So celiac disease, which can present with almost anything, constipation, diarrhea, and also issues outside of the gut. But, we can never ignore it, or not consider it at least. And I put IBD there twice on purpose. It's not a typo. The first one stands for inflammatory bowel disease. So this is something that you may have heard of. Maybe there's a family history of it, which is Crohn's disease or ulcerative colitis. And classically, blood and mucus in the poo. Maybe your child's not, growing properly, gaining weight. This is a significant illness. The other IBD is, you may have also heard of, called irritable bowel syndrome or functional diarrhea. So, and that's also closely linked to SIBO, S-I-B-O, which is small intestinal bacterial overgrowth. So, this all used to be a little bit out of the realm of modern medicine and hospital medicine, but now it's slowly sneaking its way in, because this is about gut dysbiosis and how it's potentially influences how your gut functions. So I'll just step back a little bit for people who perhaps don't understand that. And we are doing a Facebook Live on this the week after next.
Yes.
But your gut microbiome is all the healthy bacteria that live in your gut that really play a large influence in our bodies. And when that's out of whack, basically put, so are we. So this is one of the potential illnesses that can result from that. And the other thing with functional diarrhea is also the mind-body connection. I just wanted to bring that in here.
Yep.
And that's also why, when people are stressed, maybe they get a runny tummy, all those. And the same thing can happen to our children. It's not just adults.
Yeah, we got to remember that all of this is connected. I can't wait for that talk on the microbiome. I wish I wasn't doing it with you. I wish I could just sit there and listen to everything you say.
So moving on, whole body, again, much more medical. We're talking endocrine conditions, so hormone problems, gut-brain axis problems, and then other medications and supplements. Oh, a bit of a typo there, sorry. I just wanted to mention a couple and then we'll move on. Medications, the big one is going to be antibiotics.
Yes.
And antibiotic-associated diarrhea. So antibiotics, are phenomenally useful when they're needed. They should never be misused, overused, misprescribed, any of the above. But even if they are taken exactly for the right reason, in exactly the right way, they can commonly cause side effects, and most commonly that is GI side effects, tummy pain, vomiting, diarrhea. And we'll talk a little bit more about how to overcome that and how best to treat that. Supplements, here I'm talking about the side effect of supplements. So not all supplements are harmless, and not all natural things are good for you.
Exactly.
Yeah. So you have to be very careful, and specifically things like vitamin C and magnesium in too higher doses can cause diarrhea.
Okay. Interesting. And I think that's one thing we do need to remember, that natural doesn't necessarily mean safe.
Exactly.
Yeah.
Okay. So now what? We know our child has diarrhea. Do we take them to the doctor? Do they need tests? And what do we do about it? We'll just go on to the next one.
Sure thing.
So I'm just aware of that. Okay. So as always, there's some alerts, and to me, it's always about safety first.
Yes.
And so, you can have a brief look through these. I'm not going to go through each one in detail, other than to say, if your child is very young, unwell in themselves, or it's going on for a very long time. So those are kind of the overall, but by all means, please have a look at each one of these and read them through. I'm just skimming them now to see if there's anything that I feel I should elaborate on. Yep, the overnight one, that's quite an interesting one. So if your child is having lots and lots of diarrhea overnight, in other words, during periods when they're not eating, it can sometimes indicate a more significant pathology. So just to flag that one up. Is there anything you wanted to add there, Sarah? I just didn't want to linger too long.
I think the importance of trusting your gut, that often we'll say, well, if it's not normal, you need to remember that you know what normal is for your child. And I think that's the most important thing. If it differs from what they normally have, then that is an alert in itself. Okay.
100%.
Yeah. All right. Excellent.
And then the other big topic is dehydration. So
we could do a whole Facebook Live on this.
100%. So again, I'm not going to linger on here too much. I guess I just wanted to point out a few things. One, it's actually quite hard for a child to get dehydrated if they've got diarrhea alone, especially if they're of the age or developmental capacity to declare that they're thirsty. So, it's the younger children, perhaps the disabled children who are at more risk of becoming dehydrated just with diarrhea, but it's not impossible. There's a whole list of potential symptoms. And as you go down on this list, I've kind of tried to make it that it's in degrees, so that the lower down on the list, the more significant. And I just want to say, thirst isn't actually all that early in dehydration. So if you're thirsty or your child is saying they're thirsty, they're definitely already behind on their fluids. And then I particularly haven't mentioned a sunken fontanelle. And that's, in young babies, that soft spot in the middle of their head here. I haven't put it there because I think it's a very unreliable sign. And I don't know if you agree with me on this, Sarah. I think it's incredibly hard to detect, and it can cause a lot of unnecessary stress for parents.
Yes.
And I think for the younger children, it's more the nappies and the actual appearance of the mouth that's much more useful.
Yep, absolutely. And as a parent, you know that when they wake up from their nap that they normally have that heavy, wet nappy. If that's light, then that should be that alert to go, oh, hang on a sec, let's watch this. Is this the fourth nappy that I've changed today that's actually really light? Hang on, let's have a think about this. So all of these are triggers that should prompt you to look at your child as a whole, to put all these things together. And most importantly, trust your gut. There is nothing wrong with picking up the phone if you're unsure, to your GP, to Health Direct, to any of these places that will give you that medical advice if you are unsure.
Okay. 100%. Okay, so I feel like we've touched on most of this. Basically, what the slide is describing is how your child should go through these criteria for diagnosis. Are there any underlying conditions? Are we suspicious? Do they need any further tests? Minimum, a poo sample if that's going to be helpful, or maybe blood tests. But that should be guided by your healthcare provider.
Yep. And Deb, we've actually just got a question from Holly. And Holly has said, can a GP test for any of those bowel diseases, or is this something that you should get perhaps a referral to a specialist to do?
Okay. Hi, Holly. Thanks for the question. There's certain preliminary tests that a GP or a general paediatrician can order, and those would be blood tests as well as poo tests. I hate always saying this, it depends, but it kind of does depend. It depends on the child's condition as a whole. So if clinically your child was absolutely thriving and these tests all came back as normal, there was no family history of inflammatory bowel diseases, then it wouldn't be unusual not to be referred to a gastroenterologist. But if there were any concerning signs or one abnormal blood test or poo test, then yes, you would be referred to a gastroenterologist. The definitive diagnosis for most of these inflammatory bowel conditions is actually a biopsy. So yes, a gastroenterologist would have to perform that.
Okay. Thank you, Deb, for clarifying that. Okay. So there we go. Treatment.
Okay. So we'll quickly whip through a bit of treatment. Nappy rash, just because I think it's really common. And I just wanted to touch on that because the most common cause is, as I said earlier, because the poo is sitting in contact with the skin and the poo is acidic because the nutrients aren't being absorbed, the sugars aren't being absorbed properly by the gut. So it's about changing nappies frequently, going to the toilet frequently, wiping properly, using good barrier creams. I was never personally brave enough to leave my children nappy free when they had diarrhea.
No, I wouldn't be either.
Go for it if you're up for that. But that's just about having air on the rash, and that's meant to help. Sometimes I've needed to prescribe specific creams for the nappy area, a steroid-based cream to help with inflammation. Sometimes your child might need painkillers to help them. So I just wanted to touch on that. Hydration, huge topic that we're not going to go into today, other than to say breastfed babies should be hydrated with breast milk as well as oral rehydration fluid. Older children, oral rehydration fluid if they're dehydrated. If you're just trying to maintain hydration, you can use other fluids, and I'll talk about that in a second. What about food? We'll talk about that, and any specific treatment, we'll come to that now. Okay, so part of the way that I work is I look at a child's health very holistically, and the framework that I developed has 5 pillars of health: plate, play, pause, people, and protect. And that really looks at all the nutrition and lifestyle impacts in a child's life. And there are a few things that we can look at for diarrhea, and we'll, if you want to just go to the next slide, we'll just talk about them quickly. So the plate, the nutrition, hydration. So we won't talk about that in detail other than what I've already said. I've just put bone broth here, not brat. So I'm not sure if anyone's ever heard of brat. Sarah, do you remember brat?
Yes, yeah. I remember brat.
Yeah. So banana, rice, applesauce, and toast. Yep. And that was the diarrhea diet that used to be prescribed quite a few years ago as the way to help children get over their diarrhea. It's not recommended anymore for a few reasons. One, because it's not very nutritionally whole. And secondly, why would you be giving a child with diarrhea a whole lot of sugar? But anyway, that's another topic because that can actually also make the diarrhea worse, PS. So, toast, fine. Banana, if it plugs them up, fine. But yeah, it's not a diet that I would normally recommend. I've put bone broth there. I'm a huge fan of bone broth. It's very healing. It's hydrating. There have been studies done on chicken soup, which is like a chicken bone broth, and that actually show that it helps support immunity. Okay. So it's not just an old wives' tale.
It's not an old wives' tale.
And it's a wonderful way to maintain hydration in children. Just as a drink, you can give it to them as a drink. Again, older children, I'm not saying, your 2-month-old or anything like that. I'm saying children who are already on solids.
Yeah.
The role of dairy we've spoken about. I do recommend a period of dairy or lactose-free when children are recovering, so that persistent type of diarrhea. And just remember that if they're off dairy, you're going to have to get calcium from other food sources, so you just got to be a little bit careful with that. And that's about supporting nutrition. So what we want to do is we want to help, really give our children nutrient-dense foods during this time to help their bodies heal better. All I'm going to say about a low FODMAP diet is, again, this is a huge topic, which is why I'm pausing. I just want to say, look, it's out there. A lot of people know about it. In my opinion, it's never a diet that you should adopt for your child on your own. It should always be under the guidance of a dietitian, because it is a diet that was originally designed for irritable bowel syndrome. And it essentially takes out multiple foods. And these foods that are difficult to digest, and that's why they were taken out. It's a very effective diet. It should never be used long-term in anyone. And because it's taking out so many foods, there's a lot of cautions around that. So please don't ever do that on your own.
Okay, good advice. Thank you.
And then there's the role of micronutrients. So this is in terms of helping treat diarrhea. Magnesium, I've mentioned, can actually cause it. So I put that there just to remind you. Potassium, there's a potential role for it, but the strongest evidence is actually around zinc.
Okay.
So zinc can help with acute diarrhea.
Right.
The evidence isn't as strong as for my next slide, which we'll talk about. But if children are zinc deficient, it can definitely help. And I find often also the children with those very red, raw nappy rashes can often also benefit from zinc. But if again, with any supplement, you've got to be very cautious in terms of dose and how long you're going to give it for. So, you just got to be cautious and get some guidance around that.
Absolutely. Don't just go to the pharmacy and grab some zinc and give it to your child. Don't do that. You need to be being guided by your clinician.
Yeah, because too much zinc can actually cause tummy problems.
Yes.
Okay, protect. So this is the other of my 5 Ps that I just wanted to quickly talk about now. Medications. If they're on anything that could be causing the diarrhea, we need to either go, okay, well, now we know why it is and it'll pass, or we need to take them off it if we can, or manage it. Probiotics, there's been a lot of evidence around probiotics, around certain strains for certain conditions. The 3 top strains that come up, and I think this is quite helpful for parents, is Lactobacillus reuteri, Lactobacillus rhamnosus, LGG, and one that's called Saccharomyces boulardii.
Okay.
Yeah, I mean, I'm not going to ask anyone to repeat them back to me very quickly, but the last one's actually a yeast, not a bacteria. So that's one's actually, so if you're on antibiotics, for example, that's a good one to take at the same time. But, I'm getting a bit detailed here. But bottom line is that Cochrane level evidence says that probiotics help with acute diarrhea.
Yes.
Evidence.
Anybody who doesn't know what Cochrane level is, that that this is evidence-based practice up here on the scale. Okay.
So essentially what Cochrane does, it's like Sarah says, is it takes studies from all over the world and pools all of that data. So you're getting thousands and thousands and thousands of, patients, and it extrapolates information from that. So, exactly, it's, advice on steroids, really. And what is I going to, sorry, there's one thing as I was thinking, and now it's totally flown out of my head, but it was around, as I said, the evidence around probiotics is much stronger for the acute diarrhea. The chronic diarrhea, the evidence gets a lot more shaky. So just bear that in mind. But again, probiotics are incredibly harmless. There's a small group of children who are at risk from probiotics, and those usually immunocompromised children. But otherwise, often there's not a lot to lose by trying these things.
Excellent. That's a good thing. I certainly, my children, have the probiotics, and I have noticed the efficacy when they have had diarrhea as well, acute diarrhea.
So there you go. So hopefully you guys understand a little bit more about what diarrhea can mean, and that it's not always infectious, and the things to watch out for in terms of when you should see your doctor sooner rather than later, as well as a few little tips that you can implement at home, such as hydration to use, the diet to consider, and also supplements to consider, like zinc and probiotics.
Absolutely. And I think that that's one of the important things that we remember, is that making sure that you don't just start treatment at home. I mean, certainly there are things you can do at home, like rehydration, things like that, but don't go out and buy the supplements that you think your child needs. Please get advice. It's so, so, so important. And, you know, and with the advice, make sure it's good advice from a clinician like Dr. Deb. Really.
I'm sorry, I'm not saying you used to listen to me. That's not the kind of person I am. I'm just saying it's like there's so much that's out there. There's so much noise out there that it's very overwhelming. You know,
it is. Yep, it absolutely is. And how can you be expected to do a Google search and, you know, and with all this stuff that can come up first? And so that's why we are bringing these topics to you on our Facebook Lives. And we are bringing you part 3 of our Tummy Trouble series next week. What are we doing next week, Deb?
We're doing worms.
Oh, yes.
I know.
Oh, fantastic. This is a subject close to my heart. We have had worm infestations in our house. Oh, my goodness. Mum, my bum's itchy. Mum, my vagina's sore. Yep. Okay, well, I cannot wait to talk about this one with you. So we have had a couple of questions, Deb, if you've got time just to answer a couple, if that's all right. So just Fatima has asked, can lollies or possibly ingredients in lollies be a cause for acute diarrhea?
100%. Sorbitol's normally the one. Artificial sweeteners. I'm trying to remember the other ingredients, but yes, I can't remember all of them off the top of my head, but 100%. And it's usually the lollies, not chocolates and things like that.
Yeah, absolutely. And we've had that in our house where one of my younger ones sneaked a packet, because we're not a big lolly house. They are allowed them on, 80-20 rule. But she did that. She ate the entire packet and tummy pain and profuse diarrhea.
Exactly.
Yep. She hasn't done that again. Excellent. So, Deb, thank you so much for your time today. Thank you to everybody out there for joining us. Please remember to tag your friends down below to share this good evidence-based information. And we will see you again next week at the same time. Really looking forward to it. So thank you, Deb. We'll see you next week.
Sarah. Thanks, everyone. Bye.